The queues are growing to cremate Sri Lanka's COVID-19 victims. Crematoriums are busy and mortuaries are holding 2 to 3 times their capacity. More than 90 people have died every day since Friday. The government called state employees back to work last week and eased some restrictions. The Association of Medical Specialists disagrees with that decision and says the worst is yet coming. In a statement, it said, "As medical specialists, we strongly believe that economists and others have to be alive in the first place to develop the economy, and no tourists will come to our country unless and until we are a reasonably safe place." This mobile phone footage of hospitals overflowing with COVID-19 patients has gone viral. It shows patients in hospital gardens, on walls, on corridors and ICU floors, waiting for treatment. The government has denied hospitals are overcrowded, but State Minister for Health Dr. Channa Jayasumana says the overcrowding in one of the hospitals from the video has been eased. Where there is visible control is the vaccine blitz launched by the government in recent weeks. Dr. Shami Semage heads the Army medical team supporting the Health Ministry trying to vaccinate as many Sri Lankans as possible.
Sri Lanka is on a very ambitious plan for vaccinate above 18 everybody by end of September. So we are on the track so far. So what we are looking for as the military is the surge capacity.
The vaccine campaign is making record progress, with more than 500,000 people receiving their jabs in a single day. And 11.2 million people, or half the population, have now received at least one dose of the COVID-19 vaccine. Almost 3 million are fully vaccinated.
So everyone who has got one dose should not be complacent. They are still liable or vulnerable to the virus. So till we immunize maybe 80 to 90% of the vulnerables, we are not safe.
The head of the COVID-19 task force has announced people may be required to carry their vaccination cards with them in the future.
I was compelled to take it because my children are very particular that I take it.
Here the procedure is done very well. So I believe it's really important to get it.
Specialists here are watching closely as the number of infections rise, with more restrictions and even curfews to be recommended if things get worse. The numbers are not looking good for Sri Lanka, and experts are warning the next few weeks are critical. People are being urged to follow restrictions in order to minimize the number of deaths here. Minelle, Fernandez, Jazeera, Colombo.